right, let's do it.
Okay, all right. Which of the following histological findings is most likely present in this patient's bronchi? Okay, 55-year-old man with a history of smoking presents to clinic with a persistent cough producing yellowish sputum for the past 3 months. He has similar episodes for the past 2 years. Physical examination reveals coarse breath sounds and wheezing. Okay. Persistent cough, yellow sputum, smoking, I'm thinking COPD. Yellow sputum, I'm thinking like kind of that bacterial, but it's not. It could go a few different ways here. Let's see. Alveolar wall destruction, eosinophilic infiltration, fibrosis of bronchial wall, which should be like the um, fibrotic tissue, goblet cell hyperplasia, granuloma formation. Okay. In the bronchi. Right off the bat, I like alveolar wall destruction. Infiltration is almost like it could be asthmatic, and I'm also thinking like aspiration, even though aspiration usually wouldn't be eosinophilic. That's what I'm thinking. Fibrosis, like I said before, it's like I think they call it idiopathic fibrotic. I'm confused with the name. It's like they have a funny name for it. It's one of the restrictive
Okay, good.
diseases, something like that. Goblet cell hyperplasia, I'm thinking of like bird stuff. And then granuloma formation, I'm thinking of like sarcoidosis. So that's why I was like, okay, alveolar wall destruction. It makes sense because I know it would be like those type 2 pneumocytes and stuff like that. So I would go with that.
Okay, let's talk about this. So I
Okay.
like it. I like that you picked the answer as COPD and chose A because that would fit
Okay.
with COPD. Okay, but when you have a smoker that coughs a bunch of sputum, you got to be thinking of like chronic bronchitis.
Okay.
Okay, which just means you make a bunch of mucus practically, and it's always irritated and inflamed. And what you're
Okay.
going to see is what's creating all that mucus is the goblet cells. Remember, goblet cells make a lot of mucin, right?
Yes.
So you're going to have a bunch of these goblet cells to have chronic bronchitis. So I like the
Okay.
COPD would be alveolar wall destruction. So you're hooking up the diagnosis that you're thinking of with the answer choice, right? But
Hmm.
here, I think you got the diagnosis wrong here. COPD has
Okay.
coughing, but or wheezing, I would say mostly. And it doesn't usually have like wet.
Hoarse breath sounds is not part of COPD, right? Yeah.
You can have some coarse breath sounds for sure and some wheezing for sure.
Okay.
But the key difference here is the sputum, the production of sputum, right? Because a lot of times, well, on the test, right? But in real life, it's usually a mixed picture. But on the test, they'll make it very discreet, meaning that for chronic bronchitis, they'll have a lot of sputum. For COPD, it's more like wheezing, coarse breath without a lot of sputum.
Okay.
Okay.